So enough from me about USAID and what we do, and I'm going to turn to our esteemed panelists and start asking their inputs on some of these areas. Let's start by asking Atul. Atul, it would be great if you could set the big picture for us based on your experience with the Amami Group. What are the major healthcare challenges that have helped or had been helped by technology? And if you could look into your crystal ball or be an astrologer, what would the future look like in that space?
Great, thank you so much. A very good morning to all of you. Leveraging technology for solving healthcare challenges. Let's take a few minutes talking about the challenges. Once we're talking about challenges, let's talk about the challenges at the bottom of the pyramid, which is, let's say, in a public healthcare space. Now, all the people sitting in the room, we are one of those very few privileged who are able to come to this kind of a venue and have a conference and talk about various issues. However, there is a bottom of the pyramid where healthcare is not accessible at all. Here we are in Delhi and we have all the hospital. So the first problem, I'll talk about the 5 A's if you allow me. The first A is accessibility of health. How can technology bring healthcare accessible? We still have people who don't have any healthcare facilities. I've been to tribal areas of India which are very remote, where they don't even know what a blood pressure machine is about. Once we put the blood pressure in their hand and they get scared and they run away. So that is the level of awareness we're talking about. So how can we take healthcare through technology to the people who do not have anything? So accessibility is the first challenge. We still have people who travel long distances. They have to lose a day's wage and go to the healthcare facility. They take a person along. They have to spend the money. They spend on bus. They have to kind of, lose 1 or 2 days only to access healthcare facilities. So accessibility is the first problem. And I would like to know from the panel and everyone in terms of how technology will be able to solve the problem of accessibility. The second A is the affordability. We come across stories about a lot of Indians going below poverty line because of rising healthcare expenditure. While the government is doing a great job in terms of bringing the number of people below poverty line, however, every year there are crores and there are lakhs of people who are actually going below poverty line just to meet the healthcare expenses. They sell off their land, they sell off their property, they sell off their jewelry just to take care of the healthcare expenses. And how can technology play a role in terms of making technology more affordable? The third A is the availability. In terms of, we still have shortage of doctors. Someone was talking about, you mentioned about the ratio 1:1,000 is what the World Health Organization recommends. In India, as per the current population, we have 134 crore people in the country. As per that ratio, we should be having, 13 lakh doctors in the country. What's the current available practicing doctors? Around 7 to 8 lakhs. So as of now, as of today, as we speak, we have a shortage of 5 to 6 lakh doctors in the country. So there is definitely, a shortage of doctors. While we have many doctors in Delhi and in these cities, there's absolute shortage of doctors in the rural areas. And how can we bridge this gap using technology? Also, availability in terms of the entire supply chain. We still have issues to do with, supply of medicine, supply of consumables, and of course, other resources not available at the ground level in the sub-centers, in the PSCs and everything. The fourth A is how can we use technology to bring awareness? You spoke about malnutrition, sir. Well, we have to use technology. We can use audio, we can use video, simple technology in terms of reaching out and spreading awareness, in terms of getting the right health-seeking behavior, in terms of having this so-called preventive approach towards healthcare, in terms of how can healthcare be used for preventive care and not just curative care. So these are various, things and simple technology. And once we talk about artificial intelligence, we were talking about artificial intelligence, machine learning, robotics, expert systems, and all the, fancy technologies that has come in. I would like to basically talk about an approach where we can go slightly low on technology, but high on impact, because we can use simple, solutions to provide, solutions to these basic issues. This fifth A is accountability. How can technology be used to, provide more accountability in the whole system? How can we use, technology? Like you said, data is the new oil. Of course, how can we have more of digitization of healthcare records? How can we have more of MIs, reporting, predictive analysis of diseases, so on and so forth. So talking about the 5 A's, or I have bucketed the entire challenges into the 5 buckets I just spoke about. And what role can technology play to bridge or kind of to have a solution to all these issues? I was involved in a lot of projects to do with, for example, let's say, I believe everyone has access to this mobile that we have in hand. Everyone has a mobile phone in this room, I'm sure. Talking about numbers, out of 134 crore Indians, around 100 crore mobile connections are there, and there are approximately 80 crore Indians having a mobile device in their hand. They might not be having a smartphone, but they have got mobile connectivity. Why can't we leverage this connectivity to offer something like a doctor on call and just give them some kind of a help through a helpline model? Why can't we use the 50 crore Indians who have access to internet and give them telemedicine? Because telemedicine is something, which will definitely bridge the gap of the shortage of doctors. I was working on a program of Government of India called Mother and Child Tracking System, which is a helpline-based model, where, the objective of the program was to bring about the, a reduction in MMR and IMR. So why can't we use technology in terms of identification of the high-risk pregnant cases? Most of the mortality that takes place is in the high-risk category. Why can't we use technology just to have a pregnancy management, a 9-month pregnancy management through a helpline model, identify the high-risk cases, and have an intervention program through a helpline model? So where we can give a call, we can give incoming calls, outgoing call, voice SMSs, voice call. A lot of these, calls can be made to these people. So I'm talking about slightly low on technology, high on impact. And possibly this is, where, and we'll talk about scale in terms of how can we scale up these programs across the country. How can we play a transformative role, if not transformation, because through CSR, I don't think we corporates can actually transform the whole country, but we can play a transformative role in terms of bringing about change. So these are some views I have, okay, and during the course of the discussion, and of course through your questions, we'll try and address some specific issues in terms of technology, the healthcare challenges, and the future. How is it looking for the country?
Thank you very much.